course. And this time, we have here on our program, Dr. Lolita Serrano. Good morning.
Good morning.
Good
Welcome
morning.
back.
Welcome back to Rise and Shine.
Thank you for inviting me again.
Yeah, so to start our discussion, Doc, what is dyslexia? Dyslexia. And may iba't ibang mga klaseng dyslexia ba?
Iba-ibang klase, no? Actually, when we talk of dyslexia, it is primarily associated with reading problem. And of course, since it is a problem, it does not follow that it is a prediction for failure. No? And to have a better understanding what dyslexia is all about, we should also understand what it is not. All right? Number one, it is not an intellectual disability.
Okay.
Because most children with having this kind of problem have average or even more than average, above average intelligence, IQ. Yes, that's one. Second, yeah, they can, the IQ, and they do not have vision problem, visual problem, and they do not also have auditory problem. So in other words, during assessment, we have to rule out all of these things before we can say that a child has dyslexia.
Okay.
All right. So again, it is a neurological processes problem. No, since we say most of these children having dyslexia are having problem on processing of information.
Oh, okay.
It's more on, you mentioned earlier about the brain, the function of the brain. Again, balik na naman tayo sa brain, no? So if we talk of dyslexic children, let's try to look at the brain anatomy. Naku, medyo science na ito. But to put it in a nutshell, we know that right brain hemisphere, nadinig din natin yun, ano? Pag pag left brain dominant ka daw, you're right-handed. All right? Now, ano yung function ng left brain? No? So, that part, yung planum temporal na tinatawag natin, is the one in charge of language. And for a normal child, having no problem on reading, that part of the brain is bigger. It performs normal, no? But pero yung mga batang may dyslexia, ang size ng planum temporal na yon is the same as the one on the right side. So in other words, you could just imagine the work of the brain of a child having dyslexia to try to compensate. So meaning, what am I trying to say? If for an ordinary child to decode a word, for example, sight reading, maybe for the child to master it a dozen times for an ordinary child. But for a child with having dyslexia, he has to do it 40 times or even more.
Oh,
Okay. But what exactly is dyslexia?
What exactly is dyslexia? It's a processing. Let me tell you one example. To put it in a layman's language, during preschool days, children were taught all the ABCs, the alphabets of the letters. And how do we begin? Okay, recognition of words. So that's already one difficulty of a child having dyslexia.
Okay.
During the early years, maybe some children having dyslexia can read the simple, the ABCs, no? And then after recognition of letters, we have to sound the letters, diba?
Yes.
Those are the things that we learned during our preschool days. And then, once you can already sound it, you have to decode. For example, the letter D as in D, and the O as in O, and then G for G. And then when you combine it, dog. But for a child having dyslexia, they're having problem on decoding.
Okay.
So it's in the processing of information, the process, the visual.
So
processing.
that's what it means.
Yes.
Like it's what, a state where somebody has difficulty decoding?
Yeah, not only decoding. Sometimes it can be, some children having this kind of problem can surpass the early stage of reading. But later on, when it becomes complex, that's a time when these children encounter so many problems.
How does it affect their school?
Of course, it
schooling?
affects it tremendously. No, they struggle in reading
Can
compared
they
to
go
other.
to a regular school?
Yes. You find that, statistically, 70% of a school-age population in the regular classroom are children having dyslexia.
Okay, but
17%.
But our teachers and our professors do not certainly detect
sad
them
to
right
say,
away.
most teachers are not aware of this. Maybe they have heard about what dyslexia is. By the way, I'd like to mention.
What are the signs? Oh, sorry. You'd
Okay.
like to mention?
For example, some teachers are not aware of this problem, no? And let me also tell you that dyslexia is only one under the umbrella of learning disability. Because there is one thing that we call dyslexia, the dyslexia that we're talking about, the dysgraphia, children having problem in writing, dyscalculia.
Dysgraphia.
Oo.
Okay.
So in other words, take note of the word DYS, the prefix, and the word DYS, that means difficulty. Now, there are some cases also na ang prefix is letter A, alexia, meaning total loss of ability to read.
Alexia, but that's a nice name, ah?
Yes,
Yeah, Alexia, for a little girl.
Yeah, that's true. But anyway,
So that's difficulty.
alexia is total loss of ability to read.
Oh, wow.
The other one is just difficulty.
Difficulty. This
Yeah.
is total loss.
So
Total
that's why
ability.
this is a gift because it's parang the pinaka-less complicated among the other.
Siguro we can,
disorders?
the disorder is not, the disorder per se is not a gift. I think the gift here is the challenge given to the child to struggle and try to overcome the condition. But let me tell you that this is a lifelong disability. But because of so many researches, so many technologies nowadays, these children can now be helped inside the classroom. Like
Yes.
for example, the use of technology. There are so many applications na right now if you search the internet. Doon lang sa ating computer na ginagamit sa pang-araw-araw, you've noticed that there is this word processor. The screen would tell you if there's wrong in the spelling. No, di ba may lines na
Yes, yes, red,
yan,
yeah,
no? That's
underline.
one. And in some of my clients, no, who are suffering from this kind of condition, I highly recommend the use of technology, and some of the school owners, they agree with us, no, with me actually. Like for example, the use of RMS, yung tape recorder, for those children who cannot write but they can speak.
Yes.
And of course, the problem of children having dyslexia is not only in reading problem. It follows that they also have problem in writing and speaking.
So does it mean, like, example, somebody misspells a word, but let's say they mean a certain word, but they spell it in the wrong way
In a different
because
way.
they think it's another word. But
Yeah.
I mean, if you read it and you try to edit, you actually know what they're talking about. Is that being dyslexic?
No, that's another thing. That's a different one.
Oh,
I sometimes, sorry, too much familiarity, even in myself, no, sometimes I tend to misspell the word. And then later, oh, that's not what I mean. That's another
Yes.
thing. But for a dyslexic child or a person, it's really in the processing of the brain. For example, one very good example is, for example, the letter U. No, those are the things that we teach to our children. Letter U, the child will perceive it because of the visual processing problem as letter N. And the N can be read as W. And sometimes the letter jumbled, So if you are taught that the U sounds but you will perceive it as then how could you
How
decode
could you
the
spell?
letter?
Yes.
Yeah.
What
And
about-
another
yes.
thing, before I forget, the navigation as well. Because there are some children who read on the reversal side, reverse reading,
to
no?
left.
From right to left. How do we don't normally read? From left,
Left
to
to
right.
right.
And you will be surprised, people who are having this kind of problem do have problem on directionality. Tumanda na sila na hindi nila alam kung anong left
No,
and
but
right.
I don't. I don't think I'm that. But I have problems with my directions.
Really?
But not in reading. Maybe that particular area only.
Yes.
There's such thing as what we call spatial
May
orientation.
sinabi siya kanina, yung udo, pag dinoble mo yun, yung nangyari kay Louella kanina.
Yeah. So, natuluyan.
Natuloy. Kaya wala siya dito. Tama-tama. Naisingit.
I want to know, no? Kasi when my daughter, sometimes she comes home and says, Mommy, I have dyslexia or I'm dyslexic or something. I can write with my left also. She's right-handed, but I can,
That's
she says
ambidextrous.
ambidextrous. And then that's what they use in school.
Ano? What's
So, no, I mean in school, they have all these
They have
different,
to, the child
different
must
terms.
establish the hand, the dominant.
But it's
hand.
not dyslexic. It's
Yeah, it's
ambidextrous.
ambidextrous.
Yeah.
It's ambidextrous. And the teacher should, also the parents, of course, no, should establish which one is the hand, the more dominant hand. And you would know. Very simple observation. Maybe you throw the ball, then for 10 times, you ask the child to pick it up. And at the count of 10, how many times you must marami?
Okay, so being
Ambidextrous.
ambidextrous is not is not negative.
It's not negative. There are a lot of people later on who, who
Yeah.
are ambidextrous for the rest of their
Yes.
lives. But you will notice that somehow one area suffers.
Yeah.
Di ba? Minsan sa writing niya, kita mo hindi masyadong magandang sumulat. Minsan, that person would use the spoon using the left hand and then writing on the right hand. So, one hand must be more dominant.
Yan.
Not share.
Yan.
Yeah, not
But
share
before
as
we
much
go,
as
let's
possible.
mention yung ibang mga famous people na meron na
Ayan,
dyslexic
dami na,
or
oo.
meron
Oh,
dyslexia.
yes,
Yan ang
okay.
Alexander Graham Bell, inventor of the telephone.
Yeah.
And we also
And
have
yes, our trendsetting art icon, Pablo Picasso.
Yeah.
and also Tom Cruise.
Aha!
Yan.
And Jennifer Aniston.
Yeah. Whoopi Goldberg.
Ah, oh,
actress,
okay.
yeah.
George Washington. First
Okay.
US president who has dyslexia.
Yeah, there's
Yeah.
Imagine he was the president and he had dyslexia.
Yeah, they can survive because after school they're only dyslexic during school days.
Aha!
but once they graduate, no more labels and they will do it differently on their own way. That's why they become successful and most of them are creative. Yeah, they are very
okay.
creative. Look at those people who are very successful in life.
Yes.
Oh, they learn differently in their own ways, in their own style. Because in the traditional classroom, you have to follow the instruction in a traditional setting. Diba?
So it doesn't mean that they're not capable of
Ano?
getting high grades and everything. I mean, you can be a president.
Yes.
And you can be an
maybe
inventor
the
of a
academics.
telephone.
Yeah, as long as
Yes.
you're provided with the technology, you can
Pero sila
get par.
sila Picasso and sila
During their years.
wala naman
Wala
silang
namang panahon na
technology,
yun.
pero nag-excel sila. oo.
And they really failed. They failed.
Okay, thank you very
Thank you so
much,
much.
Dr. Lolita Serrano,
Okay,
for all the
most
information.
welcome. It's
Would
my
you like
privilege.
to invite our televiewers?
Yes, please. For those of you, most especially parents or maybe educators, having a case such as dyslexia or other learning problems, we do conduct assessment. Please contact us at www.reachincorporated.com. And let's help those children overcome whatever difficulty they have. And we promise you, we assure you that they can be at par with any other regular students.
Yes.
Good news.
All right.
Thank you very
Yes,
much,
thank you so
Dr.